Hi, today I'm going to speak about lipoma, the options for its treatment, and what happens if you don't treat lipoma. That is at the end. Alright, so what is lipoma? Lipoma is a very benign condition where there are deposition of fat cells in all areas of the body. So it can happen anywhere in the body except the eye, they say, because wherever there is a fat cells, there lipoma can happen. Some people have single lipoma, some people have multiple lipoma. We have seen multiple lipomas ranging up to even hundreds of lipoma in someone. Now what happens with lipoma? Now in lipoma, it's basically a genetic condition. It is not due to your nutrition, it is not due to diet, it is not due to cholesterol that you intake in your diet which goes and gets deposited as lipoma. In lipoma, you have a genetic condition where you are predisposed to mutation of your fat cells. So you cannot prevent lipoma from happening, you cannot stop lipoma from happening, and even if you treat lipoma, there is no guarantee that it will not come back. So this is just a background about lipoma. Now, when do you actually need to take treatment for lipoma? To be really honest, you don't have to get the lipoma removed. There are usually two reasons to get your lipoma removed. One reason is if the lipoma becomes bigger, it can cause some pain. In that reasons, you can go for lipoma removal. The second reason and the most common reason why people come to us for lipoma removal is cosmetic, that it looks ugly, it is inconvenient. While I sleep, I get a pressure sensation on the back, it looks bad, I can't wear a nice t-shirt. These are the reasons why people come for us for lipoma. Now, what are the options for the treatment of lipoma? We have two options basically. One is the traditional technique of removal of the lipoma, where we make a cut on the lipoma and squeeze it out and then put stitches. Now, the second option which the plastic surgeons pride themselves of doing is to reduce the size of the cut and reduce the number of cuts. So for example, if you have 10 lipomas in your arm, what we do is we make only one or two very tiny holes and we do liposuction of that area and take out the lipoma with only two holes. So you have removed basically 10 lipomas in only two holes. So that's the role of a plastic surgeon for removal of a lipoma. So these are the two main options of lipoma. The surgery is a daycare surgery. If you have less than 10 to 15 lipomas, we can do it under local anesthesia. If you have more, we usually do it under general anesthesia. Either ways, you will be admitted on the same day of the surgery and discharged on the same day of the surgery. Recovery is about 7 to 10 days and all your wounds are healed. We give you scar creams so that even those tiny holes that we do will not look like a big scar. So this is all about lipoma. Now I had promised you at the start of the video that I'll answer what will happen if you don't treat lipoma. And the answer is nothing will happen. Many people can live with the lipoma throughout their life and nothing will happen. So the only two reasons of getting the lipoma removed I've already mentioned. But even if you don't remove lipoma, no problem.